Never forget the residents of social institution ever again. Prioritize vaccination for people living in social care institution. On March 11, 2020, the World Health Organization or WHO finally declared COVID-19 as a pandemic, which means that it had spread simultaneously in many places around the world. A few days later, on March 17, 2020, the President of the Republic of Indonesia declared the emergency response status in reaction to this outbreak. Since then, the physical distancing policy has come into effect. This policy applies to all regions of Indonesia, including many institutions within it, one of which is the prison or detention center as regulated in the decree of the Minister of Law and Human Rights. And what about social institutions? Early at the beginning of the pandemic, the media reported a case of COVID-19 transmission in a social care institution, namely the Rawinala Foundation, which treats persons with multiple disabilities. At that time, at least 3 children with special needs and their 3 social care workers tested positive for COVID-19. According to the data compiled by the Ministry of Social Affairs, there are at least 353 social institutions owned by local governments, 12,266 social welfare institutions, some of which act as social institutions, and other kinds of institutions in the form of foundations, associations, and religious boarding schools that are not registered by the government. Additionally, data collected by the Indonesian Mental Health Associations shows at least 12,314 people with psychosocial disabilities live in 180 social institutions throughout Indonesia.
Social institutions are one of the places that are vulnerable to the spread of the virus, especially the privately owned social institutions for psychosocial disabilities. One of the main causes is overcapacity. Therefore, it is difficult to keep the physical distancing, especially in places that are unable to accommodate its residents properly. The residents also live with poor sanitation. Conditions in several institutions for psychosocial disabilities even indicate that residents have to sleep, rest, and defecate at the same place. To make matters worse, the nutrition they get is also inadequate. Unfortunately, these conditions has not received the government's attention. Until now, there has been no meaningful policy regarding the handling and prevention of COVID-19 in those social institutions. Based on this background, we have made several efforts to get the government's attention. From writing to President Joko Widodo on March 26, 2020, and holding an open discussions with the government, facilitated by the Directorate General of Social Rehabilitation's Ministry of Social Affairs on March 30, 2020. Following the open discussions on April 28, 2020, we held another discussions with the Presidential Staff Office regarding this issue. However, there was still no concrete and meaningful action taken by the government. Finally, on June 25, 2020, the Presidential Staff Office held an online coordination meeting and agreed on the need to collect data on the conditions of the institutions and the health status of its residents. As of August 2020, our data showed that there were 34 residents and 6 social workers who were confirmed positive for COVID-19. Among them, 17 residents and 6 social workers were known to be positive after they tested reactive to the rapid antigen test held at the Panti Sosial Bina Laras Harapan Sentosa, or PSBLHS3 in Kedoya, and PSBLHS2 in Cengkareng. The test was carried out on 3,500 people from 4 social institutions and was held in collaboration with Standard Chartered Bank Indonesia, the Department of Social Services of DKI Jakarta, CBN Indonesia, Halodoc, and Mitra Keluarga Hospital. We are still sure that the real numbers are definitely higher than what we got, considering that most institutions have not carried out either mass rapid antigens or PCR tests up until now. From media searches, we found out that as many as 80 patients with psychosocial disabilities at the Dadi Regional Hospital in Makassar were also exposed to the COVID-19. There were also 221 positive cases in psychosocial disability social institution owned by the DKI Jakarta government. The same thing happened in several mental hospitals in numerous areas, such as Menur Mental Hospital in Surabaya, Kendari City Mental Hospital in Kendari, HB Sanin Mental Hospital in Padang, and Mutiara Sukma Mental Hospital in Mataram. In early 2021, a spike in cases happened. As many as 22 social institutions in Jakarta become COVID-19 clusters, and there have been 459 people who have contracted the virus. It is also possible the similar cases occur in this other social institution. This phenomenon shows that social institutions need to be handled in immediate and massive manners, especially from the government. To urge that, on January 7, 2021, the Civil Society Alliance for Disabilities, consisting of 5 organizations, namely the Indonesian Mental Health Associations, Human Rights Watch, Human Rights Working Group, Community Legal Aid Institute, and Indonesia Judicial Research Society, held a press conference to read out their 10 demands as follows. 1. Ensuring institutions administrators to carry out health protocols. 2. Ensuring the 3M health protocols, which stands for mask wearing, hand washing, and physical distancing, to be enforced in the institution. 3. Conducting PCR tests and rapid antigen tests regularly. 4. Moratorium on adding new residents into the institutions. 5. Ensuring that residents who have been exposed to COVID-19 will receive maximum care. 6. Fulfilling nutrition, vitamins, and proper sanitation needs for all residents. 7. Creating a transparent institution monitoring mechanisms involving organizations of persons with disabilities. 8. Looking for alternatives to deal with persons with psychosocial disabilities other than institutionalization. 9. Asking the Minister of Social Affairs to pay impromptu visits to social institutions. 10. Including institution staff and residents in priority for vaccines administration. How do other countries deal with this problem? In some countries, like the UK, Ireland, and Australia, persons with disabilities and other vulnerable groups living in social institutions become priority recipients of the vaccines. Up until now, the COVID-19 cases in Indonesia continue to increase, taking the lives of thousands of health workers and many Indonesian people. And when the government starts vaccinating its residents, will the social institution residents be forgotten again? It's not too late for us to prevent the COVID-19 from getting worse. It is time to take this matter into account and prioritize them as vaccine recipients, because no one should ever be left behind.